Korle Bu has operated for the last 96 years without a paediatric intensive care unit. Hence the decision to build a facility that also has a neonatal intensive care unit and a high dependency unit. In May last year, the First Lady, Rebecca Akufo-Addo, cut sod to build the new paediatric and intensive care unit at the Child Health Department, Korle Bu. The new facility consists of a 21-bed neonatal intensive care unit and a 20-bed paediatric intensive care unit. Commissioning the unit, the First Lady, who is appalled by the maintenance culture in the country, encouraged the hospital management to draw up a strategic plan to keep the place in tip-top shape all the time.
Today is certainly a happy occasion, but today should also be a day of reflection and a call to action. How did we, as a country, get to where we are today, where our premier teaching hospital would have such challenges in taking care of our children? I believe it is important to pay attention to planning and its execution. Planning that takes into account all the variables that affect the quality of the care in an institution like Korle Bu. Strategic planning that allows us to learn more about the organization, share our perceptions, and discuss critical issues affecting or likely to affect the organization in the future.
Whilst commending the Rebecca Foundation, the Executive Officer of the Korle Bu Teaching Hospital, Dr. Daniel Asari, noted the unit will also serve as a training centre and a major referral facility in the country. He added that Korle Bu will soon go paperless and the newly commissioned Paediatric Intensive Care Unit will be first to roll out.
The standard of this Paediatric Intensive Care is world-class and is comparable to any PICU anywhere in the world. The hospital will employ innovative management practices and will go all in to ensure that this facility is maintained properly. As a part of this scheme, we have mapped our planned preventive maintenance program to ensure that the building and the facilities are kept in good working conditions in the next 10 years.
The Minister of Health, Kwaku Agyeman-Manu, is hopeful the unit will help reduce neonatal mortality in the country.
Ghana currently is confronted with high neonatal deaths, and this resulted in the country and the ministry developing a national newborn strategy. Currently, a major focus of the Ministry of Health is to ensure that Ghana achieves universal health coverage, leaving no one behind. There is no way we can achieve universal health coverage without actively reducing neonatal deaths. And I want to take the opportunity to congratulate our First Lady in putting up this Paediatric Intensive Care Unit.
The unit runs 24-hour emergency service for critically ill children. The state-of-the-art facility has 2 isolation rooms for communicable diseases, and it is environmentally and disability-friendly with all the necessary modern amenities and equipment needed for quality child healthcare.